And time to tee up a nationwide recall of thyroid tablets. I've got our Dr. Darien Sutton here joining us. Dr. Darien, appreciate you being here with us. The FDA is warning that thyroid tablets could be, in quote, super potent. What actually is the drug that they're talking about, and what does super potent mean?
This is a potentially dangerous pharmaceutical error involving what you said, a possibly super potent dose of the thyroid medication. The recall is initiated by Vitruvius Therapeutics. Now, specifically, they are recalling their 30 milligram thyroid tablets. And if you have these medications, you want to check the lot number and the expiration date. The lot number you're looking for is 504950, and the expiration date option is September 30th, 2026. So you want to make sure to double check your medication if you're using these types of meds.
Yeah, Dr. Darien, what actually does super potent mean, and what are some of the risks that come with taking a super potent medication?
So essentially, Alshin, it's too much thyroid inside these thyroid medications, and that can lead to complications. Now, we focus on high-risk groups. That can include older adults, which can lead to heart complications and heart problems. For pregnant patients who might be taking this medication, it can lead to fetal complications and even preterm labor. And then for young children who might be taking these medications, especially for an extended period of time, it can be associated with problems of growth and development.
Yeah, it feels like the thyroid is something that we don't ever actually think about until something is totally wrong. What are some symptoms of thyroid imbalance?
So to understand this, you want to think of your thyroid as kind of a gas pedal on your metabolism. So when you have too much, or when you have an overactive thyroid or hyperthyroid, that can be associated with symptoms of anxiety. Sometimes you're feeling hot and sweaty. It can even include heart arrhythmias or palpitations, frequent bowel movements, and even unexplained weight loss. When you're having an underactive thyroid or hypothyroid, that can come with symptoms of feeling cold, feeling tired, fatigued, and weak, sometimes constipation, unexplained weight gain, and even in certain cases, depression. Now, if you can understand, these symptoms can be variable from person to person, and they can look like many things. So you want to make sure to talk to your doctor and get the appropriate testing.
Yeah, Dr. Darien, before I let you go, some quick tips for people at home who are watching. How do you actually manage thyroid issues?
Well, in the emergency room, actually, we manage them when there are emergencies, and it's typically rare, often when you have too much or too little thyroid. Most of the thyroid issues can be managed in an outpatient setting. When patients come in, we're doing the vital sign checking, blood pressure, heart rate, making sure that all those numbers are stable, and then sometimes we'll test their thyroid right there and then. If you have too little, we can replace it. If you have too much, sometimes we'll give thyroid blocking medications or other medications to decrease those symptoms. But at the end of it, you want to make sure to have conversations with your doctor, especially if you're experiencing some of these symptoms, to help avoid some of those emergencies.
For sure. Dr. Darien Sutton, thank you so much for breaking this all down for us, man.